Good afternoon, everybody. To be back. Great to see you all. I'm delighted that we're having a focus on health, and not just any health. I mean, under the leadership of Brian O'Connor, who is the chair and CEO of ECH Alliance. I think we have an opportunity to look at health from a global perspective, a truly global perspective, and I think that's very, very appropriate within the context of this UN meeting, the Financing for Development Summit. And of course, I often reflect on the fact that health is not one of the 6 United Nations transitions, astonishingly. And if you want to know what they are, that's the narrative between the SDGs and what comes next, which is currently the Pact for the Future. However, having said that, I mean, I am the eternal optimist. And of course, health is there in many, many respects. We had really fascinating meetings and dialogues at the World Bank earlier this year and in Geneva at the WHA. Clearly, health affects everybody, so I think that's a good point of departure for this afternoon's conversation. And that conversation, I think, is very important in terms of how does health figure within financing for development over the next decade. And of course, in that, I always like to encourage people to reflect on a global context. And in this case, the global context means what the European Union is doing in parallel in setting its priorities. So we need a strong health agenda. We need a strong, inclusive research agenda for health. And that has to be, in my view, that has to be really supported and sustained by policy mechanisms, policy priorities, which is the weakness in the system from where I sit. Brian, the microphone is yours. Thank you very much.
Thanks very much, Declan. First of all, welcome to those of you in the room. I just want to say welcome also to our virtual audience. I gather it's over 100 people from around the world are listening to us. And I apologise for the short delay. We had a little technical problem, as you always seem to do, just as you're about to start a meeting. But I'm really grateful to everyone for attending today's meeting. This meeting is called Convergence for a reason. Over the last couple of years, as I worked with Declan and Pilar and so on, I've realised that there's so many silos in the world. I work mainly in health, and my God, are there silos there. There are people who think they are the world. I keep telling them they're not. But if you're running a big organisation with hundreds, maybe 1 million people being employed in a particular organisation in the UK called the NHS, I can understand why you might think you are the world, because you're doing so much good, but then you look at your whole structure and you say, how do people from outside break into your silo, right? How do you get out of your silo and understand what's going on in the world and don't reinvent the wheel? That's an example of what we are trying to change beginning here today at this meeting. So this is a meeting where we want to put this proposition to you. It's not one that's new. It's one that's been around forever. But I'm fed up with people encouraging us all to stop being in a silo. Because all that does is we go, you're quite right. And what do? We stay in the silo. What I've realised working with Declan, especially over particularly the last 12 months, is when I look at the science community that he has built, the Science Summit, I then went with him to the World Bank Spring Meeting, the first time I've ever been at a World Bank Spring Meeting. I went particularly to understand what the finance world thinks of everyone else. It was fascinating. I was in meetings with yourself, Meili, and what struck me was, it was fascinating. I learned a lot. What I learned was we are all in parallel tracks on freeways, autobahns, motorways, whatever you want to call them. And we're doing great work. Everyone is doing great work. So I'm not here to criticize people. What I'm saying is, but that great work is within their own silo. Now, a lot of people may disagree with me, and I don't mind, because I know I'm always right, because as a silo, I'm naturally always right. But what I want to say to you is that today is me saying to you, I believe we need to connect and converge what we do in health, what we do in science, what we do in finance, what we do in the economic impact of what we do. Because in this changed world, I don't think we have a choice. I think many years ago, the transition happened, or started. We sometimes don't know things have happened until they become obvious. Most things are not obvious. until many years later. So we used to talk about, one of Declan's normal phrases is the global south. Remember we all talked about the global south? And that's because 80 years ago, the West decided they would colonize the world again by setting up financial institutions. I'm hoping some of this is controversial because I'd like to have a discussion about this afterwards. If it isn't, I'll be really disappointed. So feel free to disagree with me. But the reality is, having set that structure up and has worked for many, many years, what we now find is that at a meeting we just attended half an hour ago, we're told that because of US aid, the decision to close US aid, the likely impact in Africa is that 14 million people will die. Think about that fact. That's a report just published yesterday, I think. What do we do about that? We get angry. What else do we do? Not a lot, much as we'd like to. But if, as I said at the earlier meeting, if that were happening in Europe, if that were happening in America or wherever, we'd all get really angry about it and maybe try to do something about it. Because it's happening in Africa, that's the colonial rule. Now, I'm not saying I can do anything about that specifically. But what I did hear at the meeting before was a lot of hope. We had financial institutions. We had the private sector. We had people who are looking at what can you do if we converge all of these great initiatives on finance and science and health and the economic impact and try to work across those motorways, freeways, and so on. Because right now, to try to work across them, there are very few crossovers in these motorways. You would die trying to get them all to work together. So we, as the Alliance, the Global Health Connector, are determined to get out of our own silo, because health is a huge sector, but it's still a silo in many ways, and try to connect with individuals in each of those disciplines. And so today I want to have a discussion about those disciplines. I want to hear your views on whether this is another one of my crazy ideas. And by the way, I should tell you, I've had lots of them. And I'm going to continue to have them. And one of my colleagues, I saw him on LinkedIn this morning, Blethen Rees, who's with us, our Deputy Chairman. We heard a quote at one of the meetings yesterday. I may have got this wrong, Blethen. If not, jump in. It was something about strategy without finance is a hallucination. That was a great quote, because sometimes you need these succinct quotes to get a message across. That's why we don't have keynotes at this. That's why we don't have slides. And by the way, we won't have them either when we go to the UN UNGA in September, on the 22nd, 23rd of September, because we want discussions. The smaller the meeting sometimes, the more output and outcomes we get. So this is a journey apart, a step on the road. It's not the end of the road. We think it's the beginning of a road of convergence. So I'm going to ask some of you to jump in and tell us whether you agree there should be convergence. Once we get agreement in that, which I hope we will, I hear from some of your messages to me earlier, we will. What I then want to talk about is, so what? We all agree. And what happens? You all go home happy because we agreed something. What I want to know is, so what? What are we going to do next? And my job at the end of this is to tell you what I think you have told me are the next steps. So I need your help to tell me what I should say at the end of the meeting. The reason we've only 1 hour of this meeting is to inject a sense of urgency as well into this proposition. So before I leave, I have to mention some. It's always a danger, you want to talk about people who are online. They cannot say anything back to me, which is a change. But if I don't mention some of them, they'll be really upset. I won't mention them all, but we have people from USA, from Africa, from Latin America, from Europe, from Australia. Our old friend George Margellis, one of our ambassadors in Australia, he seems to get up. I don't think he ever sleeps, actually. He's at every event we ever go to, whatever the time zone. So you're very welcome, George. I want to welcome particularly our friends from Ukraine. We have an ecosystem in Ukraine. We work very closely with them, and we don't want them to be forgotten with all the other stuff that's going on in the world. And then we look at India, and we look at all of these other great continents and countries around the world. So I welcome all of you again. And I'm going to start by looking around and saying, for example, to this lady who's just enthralled us in the previous session, I want you to say something of what you said in the previous session and tell us do you agree that we should be converging, first of all, and then tell us maybe 2 or 3 next steps. Malin.
Yes, we should be converging, otherwise I wouldn't be here. But I want to say that I represent the internet community, and it's an astonishing thing that the internet has been adopted around the world, not pushed by any institution. The technology existed, and then it was pulled by each country. We want to connect to the rest of the world. And I was the business partner of Douglas Engelbart, who was one of the pioneers of the internet, but he believed in networked improvement communities because he grew up a lonely boy on the Lewis and Clark Trail in Oregon, and he had no way to connect to other people, especially with the kind of intellect that he had in Eugene, Oregon. When he was 12 years old, he rebuilt a Model T Ford from scratch. It was abandoned in a field. And that experience really gave him the sense of capacity that he had. In the end, his thinking about how the internet could support our collective wisdom fell by the wayside when his whole team left him to invent desktop computing, personal computing. And he said, please don't do that, because it will take us to a dangerous place where we're all in our own heads. And so the internet was always conceived as a place where networks of communities could learn and share from each other. And I'm here to speak up that all of that still exists. The communities that did that, the National Research and Education Networks, are still all out there. And the scaffolding exists for us to be the network of communities that we were intended to be. And it's bottom up, it's not top down.
I'll eventually get the right button here. That's a good start. I'm going to jump around the room and confuse you all, which I like doing. But I know each of you got certain things to say, and don't feel, remember this is a discussion. It's not a broadcast. The point is, it's a discussion as opposed to people broadcasting to you. So we need your interventions and your view. Can I come to you, Carlos? You just arrived and you said, I said, just tell me what you think. So if you can find a microphone there, maybe you could give us your view on this idea of converging these at least four of these disciplines. What's your view? That one there, there's always a danger with the bottles. Just say who you are and then
Yes, my name is Carlos Parra. I work in Seville.
Yes.
It's a good opportunity for me to attend this interesting debate. I'm a member of International Medical Informatics Association. I'm chair of Health Information System Working Group in EMEA, and also I'm a member of the board of European Federation for Medical Informatics. I am the treasurer of EFMI, and also a member of the board of Spanish Society of Health Informatics. In a worldwide level perspective, I have experience working in open science and how can develop use health data for research at worldwide level. And I think we must continue how can make the sustainability of the progress of the research in the context to share data for the health research. But in any case, we must take account the need of the value of data, for example, for all countries in the world. No? We must work in develop the infrastructure to share data, to apply fair principles, and so on. But in any case, we must take account must be the opportunity for all people in the world, for all countries, not for short, funding and researchers in some specific countries in the world. I think it's my first approach.
Thank you. Thank you. I'll come to you in a second, Raul, because I'd like another Spanish voice involved in this, but you've just arrived, so I'll give you a second to get your breath. Bran Wong, I'm jumping over to you to see what you think. Should we be converging these disciplines?
Does this work? No? Yeah. Okay, great. Yeah, no, thanks for having me, and great to be here. So I'm Brian Wong. I split my time between working in global health diplomacy and then the other half of my time working with health tech startups, implementing innovations around the world. And I think very much, yes, we do need convergence. I think that's at the core of what I do and what we're doing here today. I've just come from a panel on health financing. So again, it's the merger of health and finance, and was in Geneva recently for the H20 summit, which was about G7, G20 health and financing, and how we blend those things. But I think I'll just reflect briefly on kind of my experiences kind of in these intersections, kind of fostering strategic partnerships between public and private sector. And I think I'll highlight on kind of three key insights that I think are relevant to the conversation today. So the first is around how I think investing effectively in health really requires, and has been mentioned just now, robust, timely data and scientific evidence as guiding principles. I've worked on various digital health initiatives with Africa CDC and FIND, and we found that evidence-based, data-driven investments were really essential, not just for effective resource allocation, but also for convincing financial institutions and donors of the really tangible impact of health interventions. And similarly, I've done some work around digital transformation in the NHS in the UK, where I live, around digitizing primary care services, and having strong scientific data really demonstrates improved patient outcomes and kind of cost efficiency, and that helps to really unlock sustained financing and political buy-in. The second point I'd like to make is that inclusive and blending financing models are really critical to scaling impactful innovations sustainably. As mentioned, I hold various advisory roles with health tech startups, and that's kind of demonstrated how combining venture capital, public sector grants, and kind of innovative crowdfunding mechanisms even can really rapidly scale solutions and serve to reach marginalized and underserved populations in the UK as well as in rural communities in India. And really crucially, these kind of blended financing approaches really allow us to deliver not only kind of measurable health outcomes, but also robust social and economic returns that then attract further investment. And lastly, I think that the third point I'd like to make is that kind of systemic convergence through integrated governance frameworks and cross-sector partnerships is really essential for sustainable health financing. So I've just wrapped up a project working with the Regionalized Vaccine Manufacturing Collaborative, RVMC, through which we kind of witnessed firsthand how really aligning regulatory standards, industry capabilities, and financing under this kind of coherent governance framework can really create an enabling environment that then will attract sustained investment and that can drive long-term economic resilience. So just in conclusion, I think aligning finance with governance, science, policy through this kind of convergence approach, as has been discussed, is really critical to achieving our collective sustainable development objectives. Thanks.
Thank you, Brian. Thank you. Rahul, now you've got your breath back. Can I come to you? Could you just introduce yourself? I know you, but others may not. And if you can get a microphone there, we could start. And just, if the first question is, do you agree that we've got to bring these disciplines together? And then give us your thoughts on the next steps, what we might do with that, please.
Okay. Well, first of all, apologies. Coming from FIDES here is a real challenge. But in the context of convergence, now much better. Okay, but first of all, I am Raúl Rosales. I work as senior fellow at Imperial College Business School and co-director of King's College Net Zero Center. I'm a doctor in civil engineering, and I developed all my career in the financial industry for more than 30 years. No, I can say I'm a financial guy, if I'm Anyway, but let me say just like 3 points about convergence. What are my thoughts about this? The first thing I have to say is that in the current context, it is something quite critical, convergence, critical. The second point is that we need to take into account 3 points. The first one, cross-sector policy alignment. We need to develop a framework that align for several sectors: health, science, finance, and economic policies. We need to align that. Ensuring, for instance, in the space of health, that the public health and environmental data inform fiscal decisions. Okay? This is not happening. This is 1 point. And of course, it supports sustainable scientific research and health innovation. The second point is integrated data. integrated data, and decision-making platforms. We need that to make it happen, the previous point. So I'm talking about establishing what I call shared data ecosystems and AI-driven analytic tools. This is starting to happen now in certain economic sectors, okay? For instance, in smart farming, with carbon markets, it's starting to happen now because we need the technology. And it's all about data. And also, this data will come out with critical information for the risk management process of everything afterwards, and finally, financial decisions. And it does affect, again, health sector, pandemics, climate shocks, economic instability, whatever. The third point is what I call interdisciplinary governance and investment models. And I would like to link with your last point, if the financial modeling, which is the last thing. Because if the first 2 points are not right, you can, Excel can support whatever you want. So we need to create the right governance bodies for that, and funding mechanisms to address this, and for this kind of interdisciplinary mandate collaborations. We need these three things. And maybe your question is, well, that sounds very nice. How to do that? We need to work on this kind of what we call in engineering, systems, systems thinking and whole systems approach. I think you are familiar with these terms. Whole systems is all about how to operationalize that. Okay, we need to, anyway, I leave it with this, Brian, sorry, thank you.
Gracias. Thank you very much indeed, Raul. I've made a note of your points. We'll not forget them. I'm going to surprise someone else. Matt, I heard you at the earlier session. Would you mind just giving your views on this convergence idea, and then just a minute or two on what you think? I heard you earlier, and I think you've got some specific ideas on how you might converge some of these disciplines.
Yeah, absolutely. I think that someone said it was de-siloing. It might have been you. But I think that, yeah, the world doesn't exist in silos, so solutions can't either, right? Yeah, I think there was a great example, Melee, that you provided, the village without a road. No one person can afford the road, but the whole village could benefit from the road. I think that holds so true. My background's in supply chain for regulated products. So, you know, whether you're moving medicine or you're moving a controlled substance, it takes the recipient, the logics in between it and the manufacturers. Those are a lot of different stakeholders, and they all have different needs. They all have different requirements, and they all have different conditions of satisfaction. In the terms of medicine, the ultimate result is healthy populations that have vaccine, perhaps. In regards to nutrition, it's the availability of the ingredients, the compounders or manufacturers, and the ultimate delivery for a nutritious population. So I think that the more that new multilateral frameworks or more financing structures, or Declan, the way you've put it, policy, can be framed to bridge or provide opportunity for convergence, I think it might be very dynamic to allow these problem statements to be approached by cohorts that are disparate, that maybe have come together for a united cause. And in that, maybe it acts as a new catalyst to provide new perspective on long-standing issues. And I think it's really interesting that this is a topic of conversation that's coming up now, as you see the USAID fall short of their commitments. And back to that statement I said, it's always the darkest before the storm. Eli, you said, you know, in crisis comes opportunity. Yeah, well, in crisis comes convergence, and maybe it's no longer a nationalistic perspective of America or Europe or Africa, but it's the human population, right? And we're one species, and we have to perform as such. So maybe that's 2 cents from the cheap seats there. Yeah.
Yeah, that's interesting. Cheap seats. I got your instant. So I've got a number of other people. Cece, could you? There's seats at the table if anybody at the back wants to move up, because some of you I know have got things to say, and I want to have the microphones available for you, so we could do that. Can I come now to you? Just introduce yourself and give us your take, please.
So it's nice to actually go after a few of the speakers that have actually set the scene. I'm Rizwana Mia. I come from the South African Medical Research Council, and you know, to follow on what you've been saying, and especially where the last speaker just said, we are a human species, we are a single entity, and that we should address gaps that can actually enable everybody in ecosystems. And the previous speaker spoke about, you know, investment in converging thoughts around ecosystems and solutions for that. And so, you know, in South Africa and much of the global South, there's a paradigm and there's an inherent gap that we have to look at and we have to address. And there's a disparity, a very big disparity when it comes to a human species. Especially we see that in Africa, our populations in Africa have not been able to generate data on their genomics, on well, much of the ecosystem has to be developed, has to be enabled from infrastructure right through to the basic science and generating knowledge on these populations. So you find that data is fragmented, disease patterns are understudied, and populations are underrepresented in genomic reference databases. With, I think, now that we've calculated, given all of the flurry of activity in human genomics, I think that global genomic databases only represent now 0.8% of the African population genome. And this is now leading towards how do we enable an entire continent to improve healthcare when we are driving AI-driven, data-driven healthcare in the global north. So with that, I'd like us to think about how we redefine science, data, finance, governance, and converge to build resilient, inclusive health systems and healthcare initiatives. And at the South African Medical Research Council, we are trying to pioneer a national initiative where we are trying to converge all of the investment government has made in terms of our infrastructure, scaled programs that have in other sectors that are going to facilitate a national human genome program and the development of a national archive for our country as a health resource, so that we can create a unified area where we can find phenotype, genotype data and enable a personalized medicine ecosystem, a learning ecosystem, and an evidence-based medicine ecosystem. So I'm going to continue after those comments later. Thanks.
Thank you. So to keep the gender balance right, and I need to come to another gentleman who I heard speak earlier. Do you want to give your microphone there, have you? Introduce yourself. I mean, I already know you, but I think the world should know you as well. But I'd like you to, if you could answer the first question is, do you believe in convergence? This is not a religious meeting, by the way. Well, maybe it is, but perhaps go ahead, please.
Thank you. My name is Eli Spencer. For the purposes of this meeting, I'm a physician scientist. I don't actually know the answer to your question. So no, to be a contrarian. I guess the opportunity is, I mean, if we don't converge, we'll die. So I guess the opposite is yes, we'll converge. Can I diverge for my part and not say something I've said before? It's also something I'm uncomfortable with. I'm going to say I a few times, and I usually like to say we and things like that, but I'm going to talk about something I'm doing. But first, I'm going to poll the room. How many people think we could have universal, essential healthcare that covered 80% of the common diseases a person would encounter? You could keep people alive for 24 hours, and we could do that in the next 5 years. Raise your hand if you think it's possible. 2, 3, 4. Okay, a few. How many people think it will happen? None. Okay. What's the cost of that in your mind? Is it $1 trillion, $10 trillion, or $100 trillion? Somebody say numbers. So if you do the math according to America, which is you take the amount of money we spend on every American and you multiply it by nearly 8 billion people, you get 14 to 20 trillion dollars. And that sounds silly. So that's not how we have to do it. The convergence of human need and really the democratization of medical knowledge through AI and resources. It makes it such that today we could have universal essential health care for everybody, and it's today. And here's how it works. I think people have a feeling of it. There are people wearing watches that do medical work. There are people in this room who have portable anti-shock therapies called EpiPens and albuterol inhalers, and we didn't really notice, but most of the things that doctors have that are special, they're not that special anymore. They've commoditized, they've come down in price, and usually the only blocker is either you don't know you can get it or you need a doctor to give it to you. Or, where's Matt? We haven't figured out the logistics to make the prices low enough yet. So a project in my lab, we started with a challenge, actually at the X Prize, but this has been my career, which is what would it take to get universal essential health care for everyone on the planet? And so we did a deep dive on it. We put it to the X Prize, and in fact, the doctors at the X Prize just went and tried to assassinate me. I'm a doctor, and it turned out I was bigger than they were. It didn't work. And we said it picked up no traction. So we made the challenge that our students and our group of lunatics could make it such that everybody would believe it. And so here's the story. Over the last 2 years, we built a project called the Lifesaver. It's essentially a hospital in a backpack. You're familiar with these technologies. We put things like portable ultrasounds, little automated defibrillators. It turns out this thing that sort of overweight people use to help them breathe at night, when it has a special code called a backup rate, it's actually a ventilator. In America, they're expensive. Everywhere else, Singapore, where we found one for $40, high quality. So all the essential things you need to stay alive are small, portable, affordable, and the real problem is either not knowing you can get them. Once you get them, you need the doctor. No, not anymore. You can have embodied AI that can tell you what's in your kit, can tell you what to do. So we bought all this stuff, we put it in a backpack, we put it together, and then NASA heard about it and said, hey, you know what, we're going to Mars. And it turns out that's a place where we don't have a lot of doctors and we don't have a lot of other things, and we might need a little thing like that. And we had the opportunity not to go to Mars because Alon's got that wrapped up. But we went to what's called the Mars Analog, which is in the North Pole. And this is, I didn't get to go, my backpack and my robot dog got to. And we sent the Lifesaver to the Mars Analog in Devon Island in the North Pole. We did our probes, we proved it could work, and then catastrophe struck. And the actual mission required medical equipment that they didn't have. And so the oldest living person on this team, and we can't say this person's name, but you would know them, they had a life-threatening emergency, and they were supposed to be medevaced out of the North Pole until NASA heard, the NASA doctors heard what we had, and they said, hold on. And they diagnosed this person, treated this person for severe sepsis, and this person did not have to be airlifted a very long distance. And right after that, the team leader fell off an ATV and had another terrible accident. And the belief now, we're past that. And we made a little cute movie with a, like, you can dance party to it. And so for me, the convergence of need, technology, and knowledge is now here. And I think what I want to say is there are probably a lot of these, I didn't think we could have them. And we need to go move past that to like, we've got it, let's implement it. I'd also argue for this USAID thing, what's stopping anybody from filling that gap while 14 million Africans are dying? If you're really saying that, get the fuck off your seat and go do something. You wanted me to swear, and I want to be Irish.
First of all, the lesson from that is do never ever travel with him, because it's quite clear that everywhere he goes there's people who have accidents or illness. So I'm not going your next expedition. Very dangerous. But what I would say is that your heart monitor going off? Anyway, what I want to say is convergence, yes, there are convergence at all sorts of levels. And I should tell you quickly that I also was chairman of a company that went for the same X Prize all those years ago. Our role was from Northern Ireland, the University of Ulster, was to do, if any of you are old enough to remember Star Trek, not Star Wars, Star Trek. I'm certainly old enough. You remember Bones, the guy? Every time somebody was injured, he ran this thing over them and he said, you need a new liver, you need a new leg, I'll get both, right? And we ended up being third, I think, or fourth in it. So we developed essentially a one tool to do that. That then translated into a defibrillator, which is a wearable defibrillator, which is the size, less than the size of a sticking plaster, now sold throughout the world. So this is where I agree that if you converge and you think differently, do not be hung up and the doctor has to sign off and everything. That's why more and more countries begin to use pharmacists, who are an unutilized resource, in my opinion. But that's another level of convergence. To try to keep us moving along, because we've got about 15, 20 minutes late, and I still haven't learned enough lessons from you as to what I'm going to say at the end of this, but that doesn't worry me. Coming to you next, and then we'll come to you, Petra. Is that all right with you? I'm going to give you 2 minutes notice of it. You're going to speak in about 2 minutes. Do you want to speak first?
After
Cece, please, jump. Say who you are and tell us what your thoughts are.
Hi everybody, sorry, a bit late due to traffic. I'm Zisko Zlakidis, I'm the head of the lab services and biobanking at the International Agency for Research on Cancer at the World Health Organization. So my worry in the convergence is that we haven't really found the commoditization model. So even if it happens, we don't really have the way to put it into the market. So one of the examples that I can give you is the CT scanners. So they're getting smaller, more agile, more mobile, but the need is there. We still need upwards of 50,000 scanners in Africa alone, and we don't see them being produced at mass. And the reason is because once you have them and you have it installed, you still need to connect all the other dots in the system so that it becomes commoditized. It's a big issue of trying to push through the technology but reach to the regulation so that the political decision is taken, so that it actually becomes meaningful and implementable.
No, just briefly, Matt, it's silo breaking is the word you're looking for. Silo breaking, yeah. And just on the money thing, listening to the cost of this and cost of that, you may or may not be aware that the cost of global fossil fuel subsidies is $7 trillion a year. So, my mantra is the problem's not the money. It's loads of money. It's not being spent on the right thing, and it's certainly not being spent or prioritized. $7 trillion per year. Think about it. And I would argue that Mei Lin has educated us a lot on stuff like digital public infrastructure, and Raul said it's all about the data, which I completely agree. But in the area of data regulation, we are seeing very, very strong divergence. There is no convergence. There's the EU regulating trying to regulate for the rest of the world. I mean, CSIS and Rita and others know a lot more about the impact of this, but it is diverging increasingly, and many of the communities that are being impacted by this don't even realize this. And this is a huge impediment in the health space, in terms of access to data, use of data, and of course, if these devices are data enabled eventually, yeah, but eventually, and as well as the development and evolution of drugs and therapies, all data enabled, but the regulatory environment is diverging and making that more distant rather than nearer. Thank you, Brian.
So we're beginning to get the discussion going, and we're learning a lot, particularly the way people think and what they mean by convergence and divergence. So that's the whole point of a discussion. No one's right. Everybody's partly right, and we have to work out then at the end of this meeting what we do next. So I'm going to come to you, Petronella, if you don't mind. I did give you a 2-minute warning. So first, the question of convergence. I've heard you speak a couple of times over the last few days, and I can see where you're heading in your country. Convergence, what do you think?
Okay, thanks, Brian. So I wasn't expecting to speak in this session. That's why I delegated Rizwana. But I just want to take it from a different angle, because I'm listening to what Eli is saying and what everybody else, quite a number of the colleagues around the table have been saying about just how many solutions there are out there, and the fact that, you know, we have so much going that we should not be having 14 million people dying and, you know, all the other problems. And I'm also just thinking back to my own village in Zimbabwe, for example, where I come from. And I realize that we can have, you know, all these magnificent solutions, but if one is in a context where there is bad governance, poor leadership, and weak or a terrorized civil society, then we will never get the kind of, you know, impact that we want to get in healthcare, but also in all the other dimensions of sustainable development. So I think I just want to echo, but without the anger, what the lady that was sitting here said yesterday, that we need to talk about all these other things that are not necessarily, you know, directly related to science, related to health, but that actually affect the kind of impact that is to be held on the ground. And then also, just maybe for the private sector to also, in terms of the solutions and the modes of delivery, to consider how to still get these solutions to people where the government itself is actually not an enabler, but a disabler, but still there is a market on the ground, and, you know, the solutions, if affordable, people would be willing. I mean, anybody can pay everything they have for health. So there is always going to be a market, but sometimes it's easy to forget that, you know, there's a whole lot of other factors that prevent impact. Thanks.
Thank you. Just let me talk briefly about Zimbabwe, or ZIM, as I learned to call it in Africa, ZIM. What's really interesting, one of our members there, Dr. Admore, is trying to create the connected smart village when you talk about villages, because this is about enabling them with your infrastructure so that those people in villages have Wi-Fi, for example, telephones and so on, and they are then able to communicate without walking long distances to see a doctor. They don't actually need to see a doctor physically in many cases, and therefore they can continue to have a safe birth, etc., etc. And what we're trying to do with our partnerships around the world with, for example, the GSMA, who represent 800 telecoms companies around the world, we're trying to encourage them to look at, for Africa, for example, of a connected village concept, which says we need to get Wi-Fi into that village. Look at what they've done in Rwanda, where by December this year, not in 10 years' time, they will have what they call a digitized population, right? This is where they have understood your point, mainly about a digital infrastructure. Is it perfect? No, but it's a lot better than it was before. And I think that's important. To your point about scanners and things, one of our other members in Africa, Baby Checker it's called, you may not have heard of it. It's where small handheld ultrasound devices are in use in villages to check on pregnant ladies. And those scans and so on are sent through the internet directly to, you don't need to walk 4 hours to see the doctor. So the fact you have more safe births, the fact that those people grow up and are productive, because people forget about the return and the productivity gains you get from that population. There are solutions everywhere. I agree with you. I think we sometimes don't look at them. We're too structured. We're too institutionalized. I say this, I don't think I am, and I'm determined not to be, and I don't want any of you to be, but I think all the points you make are good ones, but we can't allow any concerns about those to be the overriding factor. We have to look at the bigger picture and say, we need to make this work. We'll come on to financing and return on capital investment in just a minute, but I want to bring another person in. Sylvain, do you want to speak, please, from Burkina Faso? Please, just introduce yourself.
Thank you so much. So I think that the topic we are discussing is interesting for our countries particularly, how to make decision or how to guide policies. I think that for us, we need really to have science-based decision to guide policies. And for that, we need data. And I know that in the region where I'm coming from, and mainly from my organization, we have different experiences on that decision, science-based decision. I can quote the example of pesticide registration. We have a common regulation where we used to collect data, scientific data, the effect on environment, the effect on human health. And then policymakers can make a decision to restrict or to ban the pesticide. Sometimes if you have the development of resistance in pests, you need to have scientific data before to decide. So we have this kind of experience. That's why I believe that we need to have this convergence. But so people, the policymakers, they have to look at scientific data and guide their decision. Thank you.
Thank you, Siobhan. Elena, would you like to, if you can find a microphone somewhere, and just give us your reaction, please, to this?
Can you hear me? So hi, I'm Elena Lattis from Columbia University. So I just jumped in about the half hour ago. So for one, yes, I agree. I do think, you know, kind of like you even diversify personal portfolios, and when I'm looking to support my global program and domestic program, there's a diversification of funding, you know, and especially this has been important being at an institution that is taking hits from all different sides these days. I do agree before that data is essential, but I often find data also can be limiting. I can talk to ministries of health to the cows come home about how a malnourished child will die, you know, and not be able to receive cancer therapy if they're not sufficiently nourished. Death rates, I don't feel, are the numbers we need. So we need to be more strategic about what numbers. Cost is always, you know, essential, but that often doesn't. I would say one other thing is, you know, this whole meeting, I've heard the word innovate all throughout. We talked about this a little bit, but I really think that as we converge and come together, it's not necessarily about innovative solutions. Yes, I'm a scientist. I love innovation. I love, you know, the science I do. It's interesting. There's solutions to be had, but not everything. When it comes to saving lives, not everything is about a new fancy solution. Sometimes it's just access. Sometimes it's really basic. And I think that we need, as we get, you know, one of the challenges I think is when you're looking at donors or prospects that want to invest in this, they also want to invest in something that's sleek and sexy and new. And, you know, again, a lot of our solutions aren't, but do save lives. So I think that's probably a big challenge we have ahead of us.
Thanks very much. I'm going to say this, and this might again be controversial. You and I talked earlier about innovation. I think it's the most overused word in the English language, maybe in other languages as well. I just think, why the heck does everything have to be new and innovative? It's a buzzword that everybody uses, and I often wonder what the heck it actually means. There's a whole lot of things invented. We talked about patents and IP and so on earlier, about the way they're then wasted and nobody utilizes them. There are a lot of things we already have. We should use what we have. I run some companies that are innovative, and we use it as buzzwords and marketing words and to raise money from private sector people and so on. But for God's sake, just let's have a think about what we mean by that. So that's one of my hobby horses. That's English for one of my rants. So I'd like to move on. Could I ask you, I think it's Carthia, is it? Could you like to give your input, please? Just say who you are and give us your response if you can, without knocking all the glasses over. There you go.
Hi, I'm Karthi, and I work for an organization called Tawaki Health. We're a regional advocacy organization working across Africa for more equitable health policies and financing. I completely agree with everything that was shared here and the 4 pillars that you mentioned for convergence. I think we definitely have to converge. But I would add a 5th, or maybe like a cross-cutting channel, I don't know what you want to call it. I don't think it's particularly controversial. I think it's something that most of us sitting in this room would agree with. But I think it's something that's not articulated often enough in this space, and that is communities. How are we converging with communities, people as not just sources of data, not just included in validation studies, but as co-creators of solutions? And I think if we are able to include communities from the beginning, convergence will happen naturally, because people, they know what they need, they know how solutions work, they know that if an innovative machine is coming into the clinic and the clinic doesn't have enough power outlets, they can say no from the beginning. They can co-create that solution with you. So I think when we're talking about these, we have a tendency to naturally institutionalize, I think all of us, regardless of our best interests, but if we are able to include communities from the beginning and have that be a core part of how we work, I think that will change a lot of things. And to your point about funding models, I do think there are examples that we can look at, like the Global Fund, that has a more systems approach in its funding. Even though it is the Global Fund to fight HIV, TB, and malaria, I think it works much beyond the name to really strengthen health systems, to prioritize digital health programming, to prioritize community rights, gender, human rights in its programming. And its governance model includes the implementing country, the donor country, communities, implementing partners. And of course, it has its flaws, but I think it is a really good model that we can work on. And as we were talking about where does global health go in the future, it is something that we can build on. Thanks.
Thanks very much indeed. I'm going to come to you, Rita. If you could, you're from a research background, so if you could give your input to that. And then I'd like just to give you a warning. We're only about 10 minutes left, so I've still got to be educated for my 2 or 3 minutes at the end. And then I'm going to come to Blethen Rees, our Deputy Chair, to talk about communities, just particularly our ecosystems and so on, to reflect on what Carthy just said. Over to you,
so very, very quickly, conscious of time, Rita Lawler, Cancer Research Centre Manager. I, in a past life, was a computer scientist, so I completely understand the value of data, but I'm going to throw out and play devil's advocate. Has anybody actually tried to put some different data sets together? It is an enormous nightmare. It really is. And it brings me to the actual point that came to my mind at the very opening of the session when you talked about people working in silos. And I don't think it's that they intend to work in silos, and I do hate the word silo, but it does describe exactly what's happening. I think sometimes they think that they're not understood, or they don't know how to explain, or because they think others won't understand, or there isn't time. There's an awful lot of that going on. But if you use the data as the example, even within the same profession, and again, professional defect, work in pathology, try and ask 2 pathologists to write down the same diagnosis. You'll get a very different descriptive. It'll mean probably the same thing, but it will be very different in its look and feel. And that's within the same profession. Then you introduce different professions. Even within the healthcare system, they're not going to be able to talk to each other. So if we're looking to converge and start to bring in other professions that are not in the medical healthcare, we need to be speaking the same language. And I don't mean the languages that are acknowledged worldwide. I mean we need to be communicating. And I will use the example that I've used since 2011 with regard to the European Commission legislators or regulators when they drew the first draft of the GDPR, which is the General Data Protection Regulations for anybody that doesn't know that horrible 4-letter word. They stated that scientific research was not as important as public health. Let that sit with you for a moment, just so that you can understand. That's where, if we want to converge, we need them to be understanding that scientific research is important, public health is important, how we can affect the financing of. So we need to find a way to communicate with each other. Convergence or not, we need to be trying to at least speak the same language or have an AI bot that's interpreting for us. That's all I have to say. Thank you.
Hear, hear. Maybe the secret is we leave it to AI and we all just relax. Have you noticed, by the way, many of you go to the Zoom meetings, these days, and there are so many blank screens because Read AI or some other artificial intelligence is actually substituting for the person who couldn't make it to the meeting, and we all read our AI notes afterwards and begin to think that human beings will stop speaking to each other. That's a possibility as well. Bledden, I want to come to you and just talk about, I want to particularly the communities bit, and maybe a word or two on convergence, please.
So when we started the ESH Alliance, we naively thought we were breaking down barriers between public, private, and voluntary, not realizing that we had to break down those barriers in each of them before we could communicate and connect the three. Our vehicle for doing this was to create communities, but communities of all stakeholders you need to transform health and care. So the system, as in the ministries, the hospitals, primary care, regulators, and then industry, and any industry involved in healthcare, so not just hospital providers, but social care providers, pharma, tech, med tech, and then industries nobody knows are involved in healthcare, like energy, automotive. And then we put in the universities, and the universities give us three things: the teaching schools for expertise, the engineering schools for innovation, even though you don't like that word, and the business schools for ROI and other analytics. And then we throw in local authorities and housing, and we're looking for the voluntary sector, so everything from a two-person drug counseling to a national charity, International Diabetes Federation. And those communities are about transferring best practice, lessons learned, and failure from place to place. So they are geographically based. So they're either regions or entire countries. And we started with 4, and we weren't sure whether it would work in Europe because of the different funding mechanisms for healthcare systems, and also the legal structures of healthcare systems were very different. But today we have around about 85. And I suspect all around the world: North America, South America, Asia, Europe, Africa, and India. And I think we could easily double the number that we have if we had the resources to support them. But what we have found is that fundamentally people are decent. They want to help each other, and the organizations in our communities will try and help each other, and they'll do it for free. So if we're trying to work on, for instance, menopause, and we're looking at some of the treatments and the planning for it, one ecosystem will give their work to another ecosystem voluntarily. And I think that the power of convergence is to actually realize that we can really get people to work together in ways that we can't really imagine that they would do. But if you think about your circle of friends and what people will do to help each other when things go wrong in families and things, it's no different, really. So that's the basis of our community. And I would just say a couple of things. So on data, I think the thing that we sometimes forget is the data quality. So that actually when you get scientists in a room, or you get certainly people who are involved in running healthcare systems, I invariably find they attack the data. And so part of the problem is that data quality, and there's a need for cleaning data and actually improving, and so just missing fields of clinical data and data sets. So sometimes the data quality is ignored. And the other thing I'd say is data scientists, so that the tech companies, whether it's Google, Microsoft, Amazon, are hoovering up the best data scientists, and public health and healthcare systems need data scientists. So there's I think for universities, training the future data scientists and actually trying to hang on to them in systems is going to be very important. And then final comment from me, 3 enablers listening to all of you. I just think we have to have trust. We need to realize that part of making this convergence work is around building trust between the subjects, the sectors, the people. And then it's about ambition. So I just think that we shouldn't be negative about this. We should think big. And then the final thing for me is we need energy. So there are so many reasons why things won't work, but we have to sort of just run at the wall, have a bit of concussion, get back up and go at it again. You know, it's requires determination and energy to do what we need to do.
Thank you, Bledden. We're now at the stage where we have, according to Declan, my mentor here, about 4 minutes left, so I won't take 5 minutes, obviously. I'll take about 2. First of all, it's very interesting. I really learned a lot again. I always learn a lot. The problem is you learn so much, you then, how the heck does all this fit together? So I tend to be quite practical. My wife does not agree, by the way, but I think I'm very practical. And that is that I think the practical step we are going to take as the Global Health Connector is this. On the 23rd of September, in New York, during UNGA, we are having a Convergence Day. It's already set. We're going to have it, whether anybody likes it or not, because we do. But I would invite all of you, if you're in New York, and many of you know are going to be there, to come and join us on that day, because this will be the next step in the journey of trying to get convergence. Let me tell you what I think is missing out of this conversation, and that is the fact that yesterday many of us attended a capital markets session, which only Declan would have thought up. And I think it was one of the most interesting sessions. We now find there are solutions, there are financial solutions. Private sector looks for return on investment. People said, stop talking about aid, start talking about investment. Rita, I think, said that yesterday. The reality is there are pension funds throughout Europe who have huge amounts of money to invest. They get a return over a long period of time, not a short period of time as some banks would want. But actually they're already financing through pension funds opportunities and real projects in different countries across the world. So they see a rate of return. They've done all their risk assessment, done all of that. So as you said earlier, money is not the problem. It's the convergence we need to connect some of those financing mechanisms to our needs. So we have to, as a group, be able to do an elevator pitch to say, I've got this, you should invest in this, right? You will get a return of X, Y, Z. You have to speak the language before the banker will even listen to you. We all do that when we're looking for an overdraft or a mortgage. We need to, as a group, and that's one of the elements that will come out of convergence. We will have financial people at that day. We need you to join us. Second and last bit is, we will produce from this meeting a series of outcomes. We will send them all to you. This community exists already. We need you to continue to input between now and September. It's not, let's wait for the next event. We will produce that in the next week or so. We need you to engage with us and give us correctives where we go wrong, give us your additional thoughts, focus on the things you're interested in, because it is the collection of each of those ideas. We won't solve everything, but at least we're on the road to try to solve them. So I'm grateful to you all and grateful to the people online. I'm going to finish off with passing over to Declan, who'll give us his closing remark.
No, just really to say thank you very much, Brian, and to all our speakers. And yeah, we learn a lot, and I'm fascinated but very ignorant about the convergence between Western finance and Islamic finance, for example. You know, and I learned yesterday that Islamic financiers don't charge interest. You know, so FYI. So I mean, there are many conversations to be had. We can still learn a lot, but of course there is an urgency. There is. And there are many impediments, and as I said, you know, huge opportunities for convergence, but let us not be ignorant of what Rita has told us. And I think divergence in this area happens because there is no transparency, there's no communication, there's no outreach, there's no inclusion. So we have to be aware of this. Brian, thank you very much. Photo, please, and thanks to all our speakers.